Hi everyone, in this video I'll be teaching you how to side bones. All that siding means is being able to distinguish whether a bone came from the left side of the body or the right side of the body. There are 7 bones that you'll be responsible for siding: the scapula, the humerus, the radius, the ulna, the femur, the tibia, and the os coxa. In order to side any bone, you need 2 things. You need an anterior-posterior reference, so you need some sort of reference point, a bone feature that'll tell you whether you're looking at the front side of the bone or the back side of the bone. You also need a medial-lateral reference, so some sort of bone feature that you know is always found on the medial side of the bone or the lateral side of the bone. Let's go ahead and start off with the scapula. For the scapula, I like to use the spine as my posterior reference because it's easy for me to spot right off the bat. So the spine tells me that this is the back side of the scapula and this is the front side. So now I need to know which side is medial and which side is lateral. I like to use the glenoid cavity for that reference because I know the glenoid cavity is always found laterally. And how do I know that? Well, let's think about it. So the glenoid cavity articulates with the head of the humerus, right? So if the glenoid cavity were found medially, that means that the humerus would articulate with it right in the center of our body. But that's not the case, right? Instead, it faces laterally so that the humerus can articulate with it like so. So that's how I know that the glenoid cavity always has to face laterally. So, is this a left or a right scapula? Awesome, it's a left scapula. Now let's take a look at the humerus. For the humerus, I like to use the olecranon fossa as my posterior reference, again, because it's also easy for me to spot. So the olecranon fossa tells me that this is the back side of the bone and that this is the front side of the bone. You can also use the trochlea and capitulum as your reference point. Those are found on the anterior side of the bone, whichever is easiest for you. For my medial lateral reference, I like to use the head of the humerus because the head of the humerus always faces medially. Again, how do I know that? Well, let's return back to our previous example. So in order for the head of the humerus to articulate with the glenoid cavity, it has to face medially so that it can articulate with the laterally facing glenoid cavity. If the head were also facing laterally, then the glenoid cavity would end up articulating with the greater and lesser trochanters, which we know isn't the case. So with that said, do I have a left or do I have a right humerus? Awesome, yes, it's a left humerus. The next 2 bones we're going to side are the radius and the ulna. But before we do that, I want to make sure you know which bone is found on the medial side of the body and which is found on the lateral. So remember that this is always with respect to anatomical position, just like that. So the radius is found on the lateral side of the body and the ulna is found on the medial side of the body. So there are a couple mnemonics and tricks that you can use to help you remember that. So when I'm in anatomical position and I move my arm like so, the area where the radius is makes a lowercase r. Also, when I'm in anatomical position, the area or the side that the ulna is on forms a U. There are a couple other mnemonics that you can keep in mind. So one of them is that the radius is rad. So the side where your thumb is the same side that the radius is on. Or you can also remember that the ulna is closest toward you. So now that we have that down pat, let's go ahead and side the ulna. The ulna can be a little bit tricky for some to side, but again, it's like siding any other bone. So for my anterior-posterior reference, I like to use the coronoid process. So if we take a closer look, we can see the coronoid process on this side. But if I turn it around, I see the radial notch and the ulnar tuberosity. The anterior side is the side where you can only see the coronoid process. So that's what I like to use to first tell me what side of the ulna is the front and which is the back. So now it's a matter of, does the ulna go like this or does it go like this? So now we need a medial lateral reference. And for that, I like to use the styloid process. And why do I like to use that? Well, because I know that the ulna is found on the medial side of the body. So that means that the styloid process, which we can actually feel on our wrist right here, also has to be on the medial side. So, given that this is the front and that this is the medial side, do I have a left or a right ulna? Sweet, it's a right ulna. Now let's talk about the radius. The best way to determine the anterior side of the radius is looking for this ski slope right here. This bone feature doesn't have a specific name to my knowledge, but it's a slight concavity that slopes downwards, right? If we turn it around, we can't see it. It's straight. But if I look at it from this angle, there's a ski slope, this concavity. The side with the concavity is the anterior side, it's the front side. So now that I know that this is the front, I need to ask myself which side is medial and which side is lateral. Well, the radius is on the lateral side, right? So that means the side in which we find the styloid process also has to be the lateral side. Again, we can palpate the styloid process on the opposite side, on the lateral side. So since this is the front and this is the lateral side, do I have a left or a right radius? Awesome, this is a right radius. Now let's take a look at the os coxa. If you remember from our previous lecture, the pubis faces anteriorly, and that's the bone that points outwards. The ischium is rounded and faces posteriorly. So that means that this is the front of the os coxa and this is the back of the os coxa. So now I have to ask myself, does the os coxa go like this or does it go like this? So we need a medial lateral reference. And the most obvious one is the acetabulum. So the acetabulum has to face laterally. And how do I know that? Well, using similar logic that we use with the scapula and the humerus, right? In order for the acetabulum of the os coxa to articulate with the head of the femur, it has to face laterally in order for our thigh to be where it should be. If it faced medially, then our thigh would be right in the center of our body. So with that said, is this a left or a right os coxa? You got it. This is a right os coxa. Now let's take a look at the femur. For my posterior reference, I like to use the intercondylar notch because it's a pretty prominent bone feature that is easy to spot. So the intercondylar notch tells me that this is the posterior, the back side of the bone, and that this is the front side of the bone. So now I have to ask myself, does the femur go like this or like this? So the medial lateral reference that I like to use is the head of the femur. So again, using the same logic as before, in order for the head of the femur to articulate with the laterally facing acetabulum, the head has to face medially. So is this a left or a right femur? Perfect. This is a right femur. The last one we need to decide is the tibia. For my anterior reference, I like to use either the tibial tuberosity or the anterior crest. They're both on the anterior side. So now that I know that this is the front of the bone and this is the back, now I need to ask myself, does the tibia go like this or like this? Well, remember that the tibia is located medially. And we have this bone feature right here, the malleolus, that is also on the medial side. Therefore, the medial malleolus tells me that this is the medial side of the tibia and this is the lateral side. So with that said, do I have a left or a right tibia? Perfect. This is a left tibia.